The need for a combined operation to remove the vitreous body. Natural lens and further implantation of an intraocular lens is connected with the presence of several pathologies in the patient at once. In the course of phacovitrectomy, it becomes possible to simultaneously remove the cataract and the vitreous body within the framework of one surgical intervention. For the first time, such an operation was performed in 1975. Gradually, the number of publications with positive results of combined vitrectomy and phacoemulsification increased. Vitreoretinal pathologies have become more common in recent years. Not only elderly, but also young patients are prone to these problems. Combined surgery allows simultaneous treatment of two pathologies, while reducing costs and time. Phacovitrectomy is indicated in the presence of detachment of the retina, macular tear, hemophthalmos, proliferative diabetic retinopathy, etc. At the first stage, a thorough examination is carried out using modern diagnostic equipment. As part of diagnostics, visual acuity is checked, ultrasound examination is performed, intraocular pressure is measured. Examine the fundus, perform optical coherence tomography, if necessary with angiography, depending on the presence of vitreoretinal disease and concomitant diseases. The patient goes for additional tests, as well as for consultation with narrow specialists. On the day of surgery, the patient undergoes an ophthalmological examination. His intraocular pressure is measured, the fundus is examined. Pupil dilation is a mandatory element of preparation. For immobility during phacovitrectomy, a dilator is put on the eye. The patient receives anesthesia. Punctures are made in the eyeball, with which special ports are installed. Phacovitrectomy has several mandatory stages. Ultrasonic phacoemulsification. Complete or partial removal of the vitreous body. Intraocular lens implantation. After leaving the operating room, the patient receives the necessary recommendations for the recovery period. A schedule of visits and a list of medications to be taken to avoid complications. The advantages of phacovitrectomy are minimization of surgical trauma, improvement of eye refraction, reducing the number of operations, reducing the risk of complications, reduction of anesthetic load, reduction of the cost of surgical intervention and costs of postoperative rehabilitation, reduction of the recovery period, quick recovery of vision. It is noteworthy that regardless of the original pathology, visual acuity increases after surgery. Among the disadvantages: increased duration of the operation, higher probability of infection, miosis, possible narrowing of the pupil, problems in intraocular lens calculations, risk of transfer of silicone oil or gas to the front chamber.